Ever wondered about the true financial scale of brain health around the world? We're talking everything from, neurological conditions like Alzheimer's to mental health challenges like anxiety. It's this huge, often unseen economics burden.
Exactly.
Today, we're doing a deep dive into a pretty comprehensive study that tries to uncover just how massive it truly is.
That's right. Yeah, this deep dive is based on a global modeling study. It meticulously quantifies the direct healthcare spending on these brain disorders, specifically between 2000 and 2019.
Okay.
And our mission really is to pull out the most important insights, those nuggets about the financial trends and also the disparities within them.
Okay, let's get straight into it then.
Yep.
What's the big headline number for, say, 2019? We're talking trillions, I gather.
We are. The study estimated a staggering U.S. $1.7 trillion in direct healthcare spending on brain disorders just in 2019.
Wow, 1.7 trillion.
Yeah. And
Yeah.
to give you some perspective, that amount, well, it rivals the entire GDP of many mid-sized countries. It really underlines how foundational brain health is economically.
Something often overlooked, maybe?
Definitely often overlooked as a pillar of global economic stability. And what's particularly eye-opening here is that this spending grew annually by over 3.5% since the year 2000.
So a consistently rising burden globally.
Look, consistently rising.
Okay, 1.7 trillion. My mind immediately goes to, how does that break down? Is this mostly neurological stuff like dementia? Or are mental health issues a bigger piece than we might think?
That's a really critical question, and the split is actually remarkably close. Neurological disorders accounted for just over half, 51.8%, or about $894 billion.
Okay, so slightly more than half.
Slightly more. The remaining 48.2% went to mental health conditions, which is roughly $830 billion. So it's maybe surprising for some who might assume one category just swamps the other.
Yeah, that's much closer than I might have guessed.
Yeah.
So within those big categories, are there specific conditions really driving the costs? Anything jump out?
Oh, definitely. Stroke was the single costliest brain disorder. It surpassed $330 billion in 2019 alone.
330 billion just for stroke.
Just for stroke. And then when you add Alzheimer's disease and other dementias, that's another $205 billion plus.
So those two together, that's huge.
It's over 30% of all brain health spending worldwide. It really highlights the immense burden of conditions often needing extensive care, both acute and long-term.
And on the mental health side.
For mental health, depressive and anxiety disorders were the most expensive. Combined, they made up over 20% of the total spending on all brain health care.
Right. So we know what conditions cost the most. But what about how the money is spent or, who it's spent on? Did this study get into those patterns?
It did, yeah. The largest chunk of overall spending, over 40%, 41.6% to be precise, went to inpatient care services.
Yeah, hospital stays mainly.
Exactly, over $700 billion there. And looking at age groups, older adults, specifically those aged 50, 74 years, had the highest spending. That was about 32% of the total.
Nearly a third.
And they also saw the steepest growth in costs, climbing at 4.2% annually.
Faster than the overall average.
Yes. And interestingly, for the oldest group, those 75 and older, spending for brain disorders on women was almost 50% higher than for men in that same age group.
50% higher for women over 75. That's fascinating. Any idea why?
The study doesn't fully unpack the why, but it could relate to longevity differences or perhaps different patterns of care seeking or condition prevalence. It's a significant finding.
Definitely something to watch. What about younger people? Are the spending patterns different for kids and young adults?
Absolutely, quite different. The economic burden in younger groups was largely driven by mental health disorders.
Yeah.
For instance, children under 10, they accounted for nearly half, over 45% of global spending on autism spectrum disorders.
Yeah, half the global spend on autism is for the under 10s.
Yeah. And then for adolescents, so 10, 19 years old, anxiety disorders were the most expensive condition. That cost $57 billion in 2019.
Which really highlights the need for early detection and support, I suppose.
Exactly. These conditions can profoundly impact development. And then for young adults, say 20, 34 years, the largest portion of spending was on opioid and non-opioid drug use disorders.
Okay, so clear shifts depending on age. Now, this raises a big question. Looking globally, is everyone spending proportionally, or are there, big gaps?
Oh, the disparities are stark, really stark. High-income countries, They account for less than 20% of the actual brain-related disability globally.
Right.
But they were responsible for a massive 78% of the world's spending, nearly 4/5 of the money.
78% of the spending for less than 20% of the burden. That's quite an imbalance.
It is. In contrast, you have lower middle and low income countries. They carry a much larger share of the disability burden, but spent significantly less.
But you mentioned growth rates earlier.
Yes, interestingly, these lower income countries, while spending less overall, did show higher annual growth rates in spending compared to high income countries.
So maybe a slow catch-up or at least recognition.
Possibly. It might signal a slow shift, but the gap in resource allocation right now is still persistent and, well, huge.
So pulling all this together then, what are the key takeaways for you, the listener, or for policymakers trying to grapple with this?
Well, the study just unequivocally underscores the substantial and growing economic burden. It demands attention. For policymakers, it really means prioritizing targeted interventions. Like the findings specifically point to the value of early intervention strategies. Think autism in young children or substance use disorders in young adults. Getting in early seems crucial.
Makes sense.
And there was also a noted increase in spending on home health services, particularly for mental health in younger populations. Now, that could signal a positive trend globally
How so?
towards improved access, maybe? Community-based care, moving away from the more expensive inpatient models, perhaps. That could be a good sign.
This deep dive really puts the sheer scale of brain health costs into perspective, doesn't it? And just how much it varies by age, by condition, by income level. It's clearly not just a health issue, it's profoundly economic.
Indeed. And tracking direct spending with this level of detail is just instrumental. It helps us understand how resources are distributed or maybe misdistributed.
Right.
And helps us make evidence-based decisions to improve public health outcomes, trying to ensure funds go where they can actually make the most difference.
So here's something for you to think about. With this growing economic burden and a global population that's getting older and older, what does this all imply for our future global health strategies?
Yeah.
How do we prepare?